Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Welcome back to Between Two White Coats. We have our friend and nurse practitioner for wellness with us, Alicia. Yes. Thank you for joining us, Alicia. And we are talking about kind of a hot topic today. I think a lot of things in wellness are a hot topic, but this is particularly one that's interesting. Peptides.
Peptides.
All right. What's a peptide and why do we care?
So peptides, long story short, peptides are the future of medicine. Peptides are short chains of amino acids and kind of the building blocks of protein, but peptides are like little messengers that reach our cells and do specific jobs. And as we age or due to our lifestyle, the peptides that we make naturally maybe don't work as well. And so now, and for quite some time, you can actually get peptides that do specific things, carry specific messages to the cell, and you can use those for all sorts of ways to optimize your health.
Fabulous. So research is finding that these specific things that are in our body doing whatever it is they do may start to have deficits, and then all we do is replace what already exists in our body. So are any of these peptides absolutely made in a lab that aren't what's already in our body? Or is the study or the research of, we have this, we might run short on it, and we might need to replace it?
Right. So everything that is made by the pharmacies that I use, they're the basic building blocks, the amino acids, and it is made in a lab in that sense, but it's things that are already naturally occurring in our bodies.
And we're mimicking it.
Yeah, mimicking the
how I read it, and totally correct me because I may be wrong, is that it's like a key. It's like the key, and it kind of turns it on, essentially, like makes it produce better.
Yeah, absolutely. And there's so many different ways that we can use them, whether it be to treat illness or to optimize our people that are already like in that healthy world. They just want to optimize their performance or whatever. So we can use them both in kind of the medical space and in the wellness space.
So it's really cellular function, getting down to the cellular level, using these chains of amino acids to then help with natural cellular function and optimize or fix, depending on where you're at.
Correct. Yeah.
Perfect. And that would 100% be the future of how do we optimize ourselves and live to be as healthy and feel as good.
Yeah.
What are the kind of things that people are using peptides for?
Oh gosh. So who uses peptides? People with autoimmune disorders, people who have injuries, surgeries, need recovery, people who are looking to gain muscle mass and lose fat, people who want healthier skin, hair, nails. Yes.
I am all of these
There's
people.
a peptide for that. People who are looking to increase their cognitive health that maybe have seen signs of dementia or Alzheimer's in themselves or their families, or they have those genetic risk factors. So there are actually peptides that we can use that increase our cognitive function. So pretty much it's like, what aren't people using peptides for?
Right. So it's improved cellular function, and it just depends on what cellular function you're improving. So if it's your brain cells, then improve cognitive and focus. If it's your hair and skin cells, then healthier hair and skin.
Oh, and libido.
Oh,
There's the peptide for that.
Which is beautiful too, because we are in a heavy pharmaceutical driven country, and so many things get a drug. And so there's a drug for a lot of these things. There's a supplement for a lot of these things. But actually taking what your body uses when it's optimal and replacing that or maximizing that makes all the sense in the world, as opposed to using something that's maybe a bit more artificial to your body.
Yeah. And the peptides really work best in an optimized system. And so there are places where you can get peptides online, like research companies, and you'll see that those peptides, they say like not intended for human consumption. And so if you're just out, if you're Googling peptides and you're trying to find where can I find peptides safely, that's not the route you want to go, because you really need to be managed by a medical team, make sure that you're on the right peptides, that you're using them correctly to get the most benefit out of it.
It's always not more is not better in some
Correct.
of these. And so
Right.
there are protocols to follow, and people like you that do this regularly, the protocols to follow. Yes. So it's not just a free for all.
Exactly. And that's one reason why it's so important to have that medical team. So for instance, tesamorelin is one that we use for kind of increasing mass, decreasing fat, but it's a cycle 5 days on, 2 days off. There are some for cognitive health that we use for every 3 days for 2 weeks, and you only do it twice a year. So you really need to have someone helping guide you through the peptide process to get the most benefit out of it. So we're just not shooting up all sorts of things.
Where do peptides fall there are supplements that people just read on, go buy them at your grocery store or general nutrition. There are the peptides, which are natural in your body, and then there are prescription pharmaceuticals. Where do peptides fall in that? Is it more in the supplement realm? Is it a prescription? Do you have to have access through a doctor?
You can buy them through the research grade peptides. Those are kind of in the gray area of supplement that's not regulated. That is not something that I would recommend. The place where I source peptides are pharmacies, compounding pharmacies that make them. And so I have a lot more confidence in taking them myself and by, recommending them to my patients, because they're coming from pharmacies that I trust.
And is that through a prescription then?
That is a prescription.
So
through a
a
compounding
prescriber
pharmacy
must be involved,
Yes.
which also allows you to make sure you're getting it in the safest way. And let's not be mistaken to think just because something's natural doesn't mean it can't be harmful.
Yeah.
There's vitamin D toxicity. Too much of a good thing is not a good thing. You can have magnesium levels that are off. There's, even if it's a supplement that you can just buy at the grocery, doesn't mean that you don't have to monitor and have the right amounts of it. And then peptides, really making sure that you use it not only safely, but in the way that it would be most effective.
Yeah, and some of these can raise your testosterone. That's what it's supposed to do. Some of them can raise your growth hormone factors. So those are the kind of things that we need to be monitoring. So if you're out there getting peptides from somewhere and they're just kind of giving you a vial and being like, you'll see you next month, then you're really not getting the oversight that you need.
Yes, and there are not two human bodies that are exactly alike. And so even though there may be a recommendation for a protocol, when you start monitoring people, you may realize, oh, you need less of that, or you need more of that, depending on how you metabolize things or how your body responds. So monitoring, it's going to make sure you get the right therapy for you as well.
Yeah.
So how would someone start in peptides if they were interested in this? Then how would they find a provider who does peptides?
So that can be kind of tricky. If you just Google peptides near me, it's kind of hard to find somebody because even though it's really, really cool science, it's still emerging science, and not everywhere offers these peptides. So you can try Googling peptides, but there are some online providers. Again, you have to be careful, make sure they're checking labs, make sure they're taking a good history, so you're getting on the right peptide program. For our program, we include that lab panel, we include that initial consultation with the nurse practitioner, and then we include that follow-up monthly at the beginning and then every 3 months to make sure that you're cycling correctly and doing all the things that you need to do safely to be part of the membership program.
Yes, and we do it all as a combination, because these are the things that we know will make it safe and effective, and we want to make sure that we're selling people a safe and effective program.
Yes.
And the med spa industry is anything from really responsible medical professionals to some real Wild West.
Wild West.
And so a lot of peptides are found in the med spa arena. And again, I'm not downing all of the med spas, but if you come in and you speak to someone non-medical and they sell you a vial of something and you don't have a medical consultation, you don't get any kind of preliminary blood work or monitoring as you go, I think that would be something that I would be a little bit concerned of.
Sure.
How is this being presented?
And a lot of these, the compounding pharmacies, they ship the peptide to your home. So our patients get it shipped to their home, which is great. It's very convenient, but you have to teach the patient, how do you reconstitute this? How do I safely, mix the bacteriostatic water with the peptide? At what dose? How much do I mix? How much do I pull up? So all of this is complicated.
You want the right guidance. Yes, you need the right guidance. And they're not cheap, so you don't want to screw that up.
Right.
You know, like,
right.
oh, I put the wrong stuff in,
If
and
you
I
mix it at the
contaminated
wrong
the whole thing.
concentration, and you're
yeah.
just like, and you're giving yourself what you thought was the correct dose, but really it's like a tenth of what you were supposed to be getting, then you're not going to get much benefit, and then you're going to be frustrated.
Yes, exactly.
So a patient comes in and says, I'm interested in peptide therapy for XYZ. What's your next step?
So our next step would be to get their intake completed. So we take a history, find out what their goals are, what their challenges have been. We get that lab panel, and then we put them on the peptide program that's right for them.
Okay. And so you are an expert in these peptides, and you will help them. Okay, well, if your goals are to lose visceral fat, to gain muscle, to have better mental focus, then this is the peptide regimen that I would recommend for you.
Right.
So tell us about the different peptides. There are lots, and they do lots. Yeah. So give us the highlights. What are the popular ones? What are the ones that I'm learning about peptides, and I have a lot more to learn. But Amber and I already know of some because patients come in and ask, like, I want BP 157. Did I get it right?
Yep.
BPC. BPC 157. And I was like, I'm going to Google search that right now. And then I was like, I'm going to send you to Alicia, and she's going to help you with that.
Yes. Yeah. So a lot of people have heard of collagen peptides. That's pretty, we put them in our water, we drink them to help, things like that. The peptides that most people hear of right now are semaglutide, tirzepatide. Those are actually peptides. So that's kind of the most common ones. But there are peptides. There's one called GHKCU, or copper tripeptide. It's the one for the hair, the skin, you can use it as a lotion, a cream, or an injection. So it works in a couple different ways. That BPC 157, body protecting compound, it can be used as an injection or as a tablet. And for patients that have GI issues, chronic stomach upset, the oral form is better absorbed by them, because we're getting it straight to the belly where it needs to go, rather than injecting it into the subcutaneous fat.
And what are the benefits of BPC 157?
So BPC 157 is one that helps with kind of recovery. It helps with anti-inflammation, kind of calming things down. So that's one that we use. If there's a few that are like, you can stack them together. So BPC 157 and TB 500, you can stack those together for quicker recovery and to decrease inflammation.
I think these are huge, and one of the things that really make peptides unique is chronic inflammation is such a common thing, whether it's from our exposures, what we're ingesting, or autoimmune diseases, or other things that just people are staying chronically inflamed. And we don't have a lot of pharmaceutical options for
like
this.
Celiac, the most common. That's like the best example ever.
Yeah.
Because I just got through a horrible flare with my stomach a couple of weeks of
And
being
getting that
sick.
inflammation in your gut down faster would be
so
a miracle
helpful.
for you. You wouldn't be sick for weeks. You'd be able to decrease that time.
Yeah. And the cool thing about the peptides is that we can stack them. So we've got peptides, we can use them singularly, or we can stack some together that will give even more benefit. So adding on a peptide called AOD 9604, which is directed towards visceral fat, with a tesamorelin, which helps us to raise muscle mass, putting those things together, there you go.
Okay, sign me up.
Bob's your uncle, so they say, or somebody's your uncle. I don't know which, but there's nasal sprays, there's injections, there's pills. So they come in a lot of different ways, to get them inside your body, and it really just depends on what your goals are as to the best way to take them.
And a lot of these are not oral.
Correct. A lot of them, most of them are not oral, and they really. You get better effectiveness from the injections. You can find oral peptides out there a little bit easier than the injections, but they're not going to be as effective.
Yeah. And, for the most part, our digestive tract's job is to break any peptide down into individual amino acids so that it can then be absorbed, and then we rebuild it into the things that we need in our body. And so getting exactly right formulation and then letting our digestive tract break it down.
Yeah.
But it makes sense when we want to use an anti-inflammatory that to act more in the gut. The oral would make much more sense.
Yeah. Yeah.
There are so many things to understand about peptides and the use of peptides, but one example that I've had is people who are really coming in and trying to max their performance, gym performance, and or training for big races, things of that sort. And they're sometimes leaning toward less healthy ways to do that. Like even some of our gentlemen who will say, I think I need more testosterone because I'm not building muscle. And I'm like, well, there's a lot of adverse effects of really running that testosterone toward the max. And I don't want to do that to you. But some of these peptides really have great longevity to them as well. You're replacing the natural stuff that helps protect your cells and help have your cells function well. So it's a healthier way, not only to get something that's going to give you a good result now, but to really I will be interested in the research on longevity when
and there are
people
some
doing
peptides
this.
that are specifically for mitochondrial health and longevity. There's one called MOTS-C that's for mitochondrial health. It's in a protocol that's used for long COVID. A lot of the anti-inflammatory peptides are used for long COVID, so that's another world where peptides are helpful. There's one called kisspeptin that's used in fertility but also raises testosterone. So for men and women it can be helpful. And then for men who are taking, maybe who are taking testosterone and shouldn't be because they're trying to, keep their fertility and they're young, then peptides give you that option of, I can take this to raise my muscle mass without having to take testosterone.
That is fantastic.
Yeah.
What else would you all want to share?
Is there anybody peptides are not shouldn't be?
People that should not take peptides, anyone that has active cancer, because peptides can increase the cellular division, and so that's one of those things where you would have to proceed with great caution. I wouldn't treat anyone that has active types of cancer.
When we're helping cells to be healthier, we can't necessarily target against the cancer cells.
Right.
And so we may, in improving cellular health, we may be improving cancer cellular health.
Right.
And so that is a
active cancer
contraindication.
is one of the biggest and one of the very few contraindications to peptides. When you take a peptide, you might notice that you get some skin irritation, some flushing, I took oxytocin the other day for the first time, and I got a very warm feeling all up my body. And oxytocin is that cuddle hormone, the hormone of love, hormone of connection. You might get a little bit of itching at the injection site. Things like that are normal side effects. But most peptides have been shown, even at ridiculously large doses, to be very safe in the body.
What is the therapeutic desired benefit of taking oxytocin?
Connection.
Oh, okay.
So I was at a conference where there's a integrative psychologist, and she works with children that have trauma bonding history, like a lot of adopted children, any children who are headed towards juvie that have been in and out of institutions, things like that. And she treats the child and the parent with oxytocin to help gain that connection back.
Oxytocin is a big pregnancy hormone, and it helps with delivery, but also then with breastfeeding and connection. And that's so interesting.
It was really cool when she talked about what she used it for. She had a case study where she had a young boy who was about 11 years old that had already been kicked out of 3 schools, and that was one of the things she used to treat him and his mom, because they were both way gone on the stress scale from the life that they had built, which was just chaos. And so oxytocin was a part of their healing journey.
Wow, that's fabulous.
Yeah, really cool.
That is fabulous. What else on peptides? This is so
My biggest thing
intriguing.
was when I was just reading, it's the main things I was trying to think of, how to break it down. Like you've mentioned, growth and repair, hormonal regulation, and immune modulation. Those are kind of big umbrella.
Yes.
Is what they treat. And then really my other thing was who couldn't take them, and essentially it's just people with active cancer. I mean, I'm sure you do other things to kind of decide if what's right for people, but for the most part they're pretty safe. So and we're going to offer them here now, so that's super exciting. I'm super excited. I'm sign me up. Let's figure out what we need, Shelley.
Absolutely.
Patients with autoimmune.
I think I need all of them.
Autoimmune treatment for autoimmune disorders. Patients. There's one called DSIP. It's a delta sleep inducing peptide. So people who have insomnia, we can
What's
try
the
that.
average cost? I
So-
know it varies because it's so.
It really does. So the average cost per month per peptide is anywhere from $150 to almost $400. It really just depends on how specialized that. Some of the peptides that are more for cognitive function, that have been studied in dementia reversal, they're pricey, but you only use them. That's one of the ones that you use every 3 days for 2 weeks, and then you stop for 6 months, and then you use it again. So it really just depends on the peptide, but somewhere around $150 to $400.
Well, I always say prevention and wellness is so much cheaper than illness. And so I know that $150 if, per peptide, if you're stacking, I'm sure that can get costly, but then what you're looking at in the long run is prevention of disease, and being sick is expensive.
And once we get our body back to that metabolic state where we are optimized, then we cycle off. It's not something that you have to be on forever. You use it to repair metabolically, and then you can come off of it and those cells do what they're supposed to do for a while. And you might have to go back on it down the road, but it's not anything that you have to stay on forever.
Yeah, and it definitely sounds like there's different types of patients who are going to benefit from this. One are people who may not have harm but are trying to prevent it and wellness, and so trying to combat aging, trying to work for optimum longevity. And those types of things probably require less and for a shorter period of time. And then you have the people who have had long COVID and they felt bad for 3 years now, and their body is way out of whack. And we're just really trying to get their body to do what it did before it got so interrupted. Autoimmune, chronic fatigue, so many of these different things that and it's going to require a knowledgeable provider to be able to say, okay, in your situation, we want to approach it this way so that people get the maximum therapeutic effect in a safe way.
Yeah, definitely.
Well, stay tuned because we're going to be trying these peptides. I'm super excited about it. I think it's a fabulous thing that science has found these natural things that our body has, and then over time we have less of, or with interruption like COVID or autoimmune disease, it messes it up, and we can simply get back. So this is root cause medicine. This is a functional type medicine at its best, where we say, well, what is the underlying fix for this? And the most natural way that before we interrupted your body's process, it would have done this on its own. You know, most of the time our bodies fix themselves, and we are made in such an amazing way that our bodies tend to want to heal. And if we can get those natural things that our body uses that maybe it's missing or just missing enough of back in, our body's going to naturally go back to where it needs to be. I think this is going to be just earth moving for people who have been struggling with autoimmune disease and long COVID and chronic fatigue and things that, you know, in our Western medicine, we're very good at saying, here's what we're calling it and here's the drug that we're giving it. But what about the people who just really, we go, well, you have symptoms. We don't know what that diagnosis is, but your symptoms can be improved by optimizing your body. So let's try a peptide protocol.
And another great way that we can use peptides is for patients who have been on a weight loss journey and maybe lost a lot of weight quickly, and they've lost muscle mass and they're really trying to build that back in a new frame. Peptides can help them put that muscle mass back on in a safe way.
Yes, and everyone knows that we feel that the peptides that you started with, semaglutide and tirzepatide, are very effective in the weight loss journey, but it is non-specific weight loss and you lose muscle too. And so unless you've been actively working out and building that muscle back, you may find, and we recommend doing a body composition, looking at what are you made up of, and you may find that you are low in muscle mass, or that you've lost but you still have too much visceral fat, which is the metabolically dangerous. And so being able to target those things, and up until now, when people would say, how do I lose my belly fat? I would be like, when you figure it out, can you tell me? And so being able to have a tool for something like that is fabulous.
And that you can use alongside the tools that you're already using without being worried about its safety.
Yes, it is super exciting. I am excited that we will be able to offer
and
this.
What a great compliment.
What our protocol is.
What a great compliment to the services that we already have here.
Yes.
I mean, it just, we already have such great tools with the infrared sauna and with the cryotherapy and with the IVs that we offer. And now it's just going to be one more really cool tool in the toolbox.
Yes. And when we're talking about wellness, really helping you to optimize your health and wellness, this is going to be an incredible tool to help people and customize, personalized root cause medicine, which is something that the three of us are super passionate about.
Yes.
Yay.
All right. Thank you for joining us on our conversation about peptides. And Alicia, thank you for all of your wellness knowledge.
Yes.
We're so excited to roll this out and be able to get people to have great success in peptides.
Yes. Yep.
We like to leave you on a good note. So here's today's Tell Me Something Good. Something good is second chances. Let's face it, sometimes we just don't get it right the first time. And there are second chances in this life. I am so grateful for that. We have all needed second chances. I appreciate second chances, and I'm going to work hard to give other people second chances. Thank you for joining us today, and until next time, take care of yourself.